Irish Gone White for the last 2.5 years. And, wanted to just chat with you guys today a little bit about social isolation and loneliness. At this current time, as you know, during COVID, this is all affecting us. And for some of us, this affects us, even before COVID has occurred. So, I would like to definitely have it an open discussion. And so as she mentioned in the end, we can answer all these questions. And if you guys don't have questions, you just have comments, I'm open to listening to that as well. Just kind of, anything you can share with us that'll help the group would be appreciated. So first I wanted to talk to you about what was our objective today. So, first I wanted to talk about how do we distinguish what all these things are, because it's a little bit different. There's a difference between having, being isolated, feeling actual lonely, and then symptoms of depression. Those are all different. They're not all necessarily the same. Okay, and then I'd also like to talk about how do you identify these issues? What are some warning signs, some tips and kind of traps that we can fall into and ways that we can kind of fix those traps. Then we'd also like to explore, the strategies to combat these symptoms. So social isolation. So first of all, why are we talking about this? Why does it matter, right? So they've done a lot of studies actually showing that social isolation and the feelings of loneliness can affect your mental health, your physical health, and your cognitive health. So sometimes, people may have these unrecognized memory problems, and we assume that people have onset or the beginnings of dementia, but there's actually some underlying psychosocial factors that can be affecting this. And obviously you can be at greater risk of depression if this is kind of ongoing, you're not addressing these issues. And as I mentioned, malnutrition also and poor health. Some studies have shown about decreased immunity. So people have more inflammation and less of or weakened immune response. They maybe don't sleep well when this occurs. And this is all, things that we want to try to avoid if at all possible. I think there is kind of a, stigma out there where people just think, well, as you get older, or, if you're in certain conditions, this is kind of a normal part of aging process, but it's really not, it shouldn't be, and you shouldn't feel that way. So related clinical studies that I want to talk about, the part in black is just the actual, studies that they've done, meta-analysis, studies that they've done specifically about this. So I'm sure you may or may not have heard of what they call the flight or fight response. So this is kind of when your body decides to deal with some type of threat. So either you kind of ramp up everything and you go into fight mode, and flight response. So that's kind of important. So what happens when this occurs is that your actual immune system, your actual cell, they've done studies showing that the genetic cells can decrease for your immune system, and then you have a higher inflammatory markers, and these can, sorry about that, and higher inflammatory markers. These combination of these things are detrimental to your immune system, causing higher risk of everything. The way I kind of explain to patients is kind of inflammation in general is the root of all evil when it comes to health. So higher inflammation can increase your risk of cardiovascular disease, can increase your risk of depression, can increase your risk of heart attack, strokes, you name it. More infections, higher cortisol levels, that's more inflammation. And this all, affects your physical and mental health. So that's why it's important to kind of focus on these things. Interestingly enough, I found this recently that I thought was really interesting, that they say that lack of social connection can actually be worse than smoking. So smoking 15 cigarettes a day can be the same as this, or even people who have alcohol use disorder. And then it can be twice as harmful as even being obese. So obesity is a major, issue that we deal with in our society as well. So it's kind of interesting to know that this can be on the same realm of that as well. So that's why it's really important for us to talk about this, for us to recognize it as individuals in ourselves, but also in our friends, in our family, in our cohorts, we're able to kind of identify these things and try to help them as well. So what are some factors that kind of will contribute to social isolation? So, being retired is definitely one of the risk factors. I think that people, when they're used to being functional, productive in their everyday life, they're used to going, into work every day, seeing their coworkers, and, kind of having those type of social interactions. When you retire, you don't have that anymore. And so your day-to-day activities are kind of different, right? You get bored. You may not be interacting with the same amount of people. The other major problem is friends and family. So as we get older, unfortunately, people either move away Some people pass away. You don't have that same, you know, connection as you did before. And then of course with the pandemic, with this COVID pandemic, it's a major change to all of us, you know, young, you, old, children, everything, you know, this has affected all of us. So that's another major risk that's been going on more recently. And then, you know, sometimes as you get older, you may have some trouble hearing. And for a lot of people, you know, they may dismiss that and just, you know, oh, I don't want to go see an audiologist. I don't need a hearing test. I don't want to wear hearing aids. But, you know, actually this really affects your interactions with other people, because if you're on a table and there's a group of, you know, 2 people, even 1 person, and they're trying to communicate with you and you're not catching everything that they're saying, or you're missing a lot of the conversation, you're obviously not going to be able to engage with them as much as you would have prior to that. And not having that engagement, you kind of isolate yourself from that, you know, conversation, and, you know, you're not able to contribute, which is a problem. And so I have seen a lot of patients, you know, with this, you know, situation. Actually, they come into my office, they have problems with hearing. They may be there with a family member, and I'm asking them questions, and the family member is answering the whole time. And, you know, they're not even able to, they feel like they're not able to engage, or ask me, you know, again, you know, what did you say, doctor? I couldn't hear you. And so, you know, they just feel isolated, and that can, you know, that's not ideal for them. Another thing would be, for example, if you don't feel like you're part, you know, of you don't have a sense of community. So that's also very important. And so, you know, if you live in a nursing home, then, you know, this may be not as bad of an issue for you. So what is the difference between social isolation and loneliness? So there's a difference. So first, it's important to know that some people feel lonely when they're around a lot of people. And then, you know, you can feel alone, you know, and still not feel lonely. So first of all, a lot of it has to do with your personality, kind of like what your preference is. And for some of us, some people are loners, you know, and they just do prefer to be alone, and they feel content. So the key differences between social isolation and loneliness is what your personal feeling is. How do you feel? How do you subjectively feel? Do you feel distress about being alone? Do you feel, you know, like some form of solitude? Like it all kind of depends on the actual person. So the social isolation is the objective physical separation. So that's what we've been told to do with this whole pandemic, right? Socially isolate, you know, physically stay away from people, stay 6 feet apart. You know, don't, you know, join large gatherings and things like that. So that's social isolation. For some people, they've been living their whole life like that. That's just kind of the way that they are. So they may not feel lonely. That may not have affected them as much. And so that would be okay. But if you're feeling that negative feeling, that loneliness, and that's where it becomes a problem, because that loneliness, that sense, your perception of what that social isolation, how is affecting you, can progress, and that can lead later to depression. And again, that's not where you want to be. That definitely requires treatment and intervention at that point. So what are some signs? So signs and symptoms of depression. So so one of the major things is avoiding social contact, right? Which you've been told to do over and over again. But this is more of you deciding to avoid the social contact, not because, you know, of COVID per se, but it's just you're kind of withdrawing. It's more of a sense of like withdrawal from people. And so there's, you know, even with the pandemic, there's other ways that you can continue with your social activities, you know, using these video chats, you know, using FaceTime, Zooming with family members and friends, you know, doing things like that. So you can still decide to reach out to people without having to feel that loneliness, as I mentioned, or this social isolation. But unfortunately for a lot of people, when they, you know, become depressed, that's one of the key things that happens. They just withdraw, you know, they withdraw from their friends, with their family, they withdraw from social activities. You know, the things that they're used to kind of liking to do, they just are not wanting to do them as much. And that's how you kind of differentiate, you know, does somebody need treatment? Do we need some type of intervention for, you know, depression? Or is this, you know, patient kind of just feeling a little bit off and needs, you know, maybe some counseling versus medication? The key thing is, how is it affecting your daily life and how you're overall feeling? So I want to talk a little bit about kind of 6 common traps that people fall into for depression, and everyone is different, right? And so depending on, you know, how you kind of deal with this, you know, will depend on how, you know, the outcome is. So we'll talk a little bit about that, but it ends up being like a perpetuous cycle. You start, with one trap, and then you fall into another trap, and then you just kind of keep rolling on, which is not ideal. So these are the kind of like 6 behavioral pitfalls that I was talking about. So one is the main one, which is a social withdrawal. And then rumination, which is like focusing kind of on just, negative things. And then self-medicating with alcohol. Some people turn to alcohol for this as well. Skipping exercise. Of course, if you're somebody who does exercise, seeking sugar highs, changing your sleeping habits. So sleeping and eating habits are also kind of signs of depression. So if you notice that you're just, more depressed, sometimes people tend to eat more. Some people tend to eat less. And then of course that affects your sleep as well. And then also negative thinking. So this is the first trap, is the social isolation. So, this is like the inherent urge to kind of pull away from others. You're wanting to shut down. Like I said, it's kind of, it's like a vicious cycle. So the problem is that the more that you social isolate, it's actually going to make everything worse, not better. And so, you kind of end up stressing out your brain. And then the way to combat that is to stop the social isolation. And actually social contact is going to help you improve that. So, this is just like my thing about being able to fix it. What happens in social isolation? So yeah, you can interact, reaching out to friends and family. Like I said, during this COVID time, it may not be so easy. You're not gonna, if your family lives away in another state, you may not want to get on a plane, which is completely, reasonable. But, you can use the phone, you can use video chats, FaceTime, and things like that. But, it's always a good idea to just, like, hey, I remember so-and-so, like I haven't talked to her, my old friend from college or high school, or my old job, I haven't talked to so-and-so for 3 months, so maybe just keep a list of people who you'd want to contact with, and, call them, reach out to them, and just reconnect. I think that that's very important. So the second thing is rumination. This is another trap. And so this is like when you're kind of dwelling on a specific thing, or kind of brooding on, things that are negative, mostly like feelings of, sense or feelings of failure, some type of loss or something like that. And it's like you're kind of rehearsing these negative thoughts over and over again. And so people can just, end up misinterpreting things, so like, for example, if you're at a grocery store and, the person in front of you, gets a smile from the grocery checkout person, but you didn't get one. So maybe somebody else will not even look into that. They may not notice, or they might notice and think it's not a big deal. But if you can ruminate about that too, and you can go home and say, oh my God, obviously, people don't find me very pleasant. Nobody's smiling at me. This keeps happening to me. Why is this happening? And so this is kind of, a sign of what rumination is like. So ways to kind of help and fix this is to help redirect your attention of this activity and just try to focus on something else, that's in a more positive light. Take up activity, reading a book, social engagement, things like that. So the third would be self-medicating with alcohol or even drugs. And so this is, kind of one of those things that, could be easy for people to fall into, because, having one glass of wine with dinner or something like that is okay. But once you start drinking, first of all, by yourself, and drinking more than 1 or 2 at a time, and you're not engaging with people when you're doing this, it's not part of a social activity. And that's when it becomes kind of, a problem. So, and this is what happens a lot, people, if they feel anxious or depressed, they end up using alcohol to kind of calm them down. And yes, it's definitely a depressant in the sense that it will kind of calm you down, calm your nerves and all of that. Especially, for example, if you have social anxiety, but overall, it's going to kind of depress your immune system. And, I know sometimes people say, well, I always have like 2 glasses of wine before I go to sleep because I sleep better. But, the thing is that the alcohol kind of helps you fall asleep, right? Because it makes you really tired, but it actually throws off your sleep pattern, and it changes your sleep cycle. And it's actually giving you a false sense that you're sleeping better. You might fall asleep faster, but you're not getting quality sleep. And so again, that's part of that vicious cycle, because you're drinking, you're going to sleep, you wake up, and then you're actually not getting quality sleep. And then you just constantly keep doing these activities over and over again and falling into this trap. So ways to kind of combat that or fix this. So this is when you start to notice or you question if you're having drinking habits that are somewhat questionable, this is a good idea to, time to kind of contact your provider and see if there's, something, how they can help you and something they can do to kind of help combat all this. But another problem is too, alcohol in general has a lot of interactions with medications, lots of different medications. So that's important to kind of notate that as well. So trap number 4. So this is skipping exercise. Of course, this is important primarily for people who exercise regularly. So if you never exercise or you don't really are not that person that joins those kind of, or even group activities, doesn't have to be exercise, but if there's some dancing, swimming, yoga, walking, activities, bingo, whatever it is that you normally engage in, if those things are being offered to you and you're not engaging in them, then that's can be definitely a sign and a clue to yourself. Like, I've noticed I haven't, or somebody mentioned, hey, you haven't been, at the bingo session for the last like 3 weeks. Are you okay? Like, what's going on? So, you can kind of notate that and also help others to notice if you feel like they're getting withdrawn. So the thing is the exercise is very important to kind of help release a chemical called endorphins. So those are really important. Those are like our feel-good hormones, right? And so we need these, chemicals to feel good. And it, like I said, it's like a trap and a vicious cycle. But the more that you stop doing those activities that increase dopamine and, serotonin in your brain, as well as the endorphins, then the more likely you are to continue to, stay in this kind of depression type of cycle. So, people who have clinical depression will have lower levels of these chemicals in their body anyway. And so that's why, when we have patients who are depressed, they say, okay, well, try to exercise, do things that, you like, because we want to increase these levels. It's not only about giving you medications, right? And there's other ways to kind of help with this stuff as well. So as far as a fix, this is what we talked about, like trying to also engage other people, somebody that's going to kind of help you out and maybe will help motivate you, help initiate you, to do some exercise or do these activities and things like that in a way that will make you feel like you're being nagged per se, but kind of more like encouraging, finding somebody who does do those same activities or exercise so you can have some accountability and again, feel, connected to another person. That's important as well. So trap number 5 is seeking a sugar high. So yeah, this is also pretty common. So, it's all kind of goes back, to the same thing I was talking about as far as like inflammation, and things like that. Because what happens is, so, you're kind of feeling down, right? You're feeling low and you kind of, your body's craving sugar because it's craving something that's going to help pick you up, to give you more energy, and that's your way of kind of doing that. The problem is then, with sugar, you eat something you might feel good, but it's only temporarily. So you'll have that like sugar high feeling and then you crash because, your glucose levels will kind of shoot up real high and then they come down. And so what are you going to do? Eat more sugar because you want that feeling again. And the problem is not needing the sugar. The problem is what's causing you to crave the sugar to begin with is that lack of energy, right? That lack of motivation. And there are definitely healthier ways to do that than eating a bunch of sweets and ice creams and things like that. And so, ways to kind of fix that would be to try to engage in snacking and things that are much healthier for you. So, for example, if you're not allergic to nuts, like snacking on just plain nuts are good, or doing butter, like almond butter, peanut butter. Those are kind of like high protein things that also have high good fat. So they can help without giving you that sugar high and that kind of crash. Vegetables, of course, can help. And even chickpeas, so like hummus, you can snack on hummus, for example, with carrots, that's a good snack. Nuts, avocados, all of those things can help. But definitely like when it comes to sugars, think about like sodas and, desserts and sweetened teas and all those things that can definitely cause this effect. And the issue is in general, when we consume a high sugar diet, this also tends to increase inflammation in our body. And as I said, inflammation is the root of all evil. not just increase your risk of obviously diabetes, but high blood pressure, fatty liver, again, heart attack, strokes, and then the higher inflammation you have in your body, then, all of that, it kind of just all kind of combines and causes more of an issue. And so ways to kind of combat eating those high sugars is, one, not doing it, but two, doing things again, like exercise and stress relief and things to kind of help decrease inflammation in your body. So another trap, or last trap actually that we're going to talk about today, is just negative thoughts kind of in general. So, just kind of probably not being open to different activities as well can be a problem. So you're kind of prone to just thinking negative about everything, like, oh, so-and-so, invited me to do this. Oh, I don't want to do that. I'm not interested in doing that, where everything's kind of just like this negative kind of thought process. So, you don't want to anticipate, you don't want to assume that something's going to have a negative result, right? You don't want to anticipate that. You want to just kind of try to fix those thoughts by just stopping yourself in the middle of that and just saying, wait, no, maybe that's not the case. Maybe this could have a positive result. The only way you're going to know is if you try it. And so you have to try to force yourself to be proactive, in this kind of positive way. And then you're going to be more likely to yield positive results that way. So, these are things that I've talked about, are ways to kind of help yourself, but I think it's always important to seek out to like a specialist. So therapy, counseling, psychotherapy, talk therapy, they do cognitive behavioral therapy. And these are all ways that they can kind of help you, because one thing is you being able to do these things on your own by trying to become more socially kind of engaged, reaching out to loved ones, having these kind of feel good feelings. But that's one part of it. The other part of it is actually being able to internalize that, right? So you're doing these external things to make yourself feel better. But I think counseling, working with a therapist on like coping mechanisms are, also very important. So in general, what do you do if you are feeling lonely, or if you kind of feel like you might be getting depressed, or, somebody who's kind of in this situation and you want to figure out how you can help them? So, it's always a good idea to, seek out some type of specialist, a therapist, a doctor, a counselor, a pastor, friends, family, people in the community that can help kind of talk you through it and maybe are able to give you resources that you can use, and like I said, I know with the COVID, things are a little bit different, but, a lot of these services are being provided now through virtual ways. So in a video visit, they have in-person visits, of course, but they have virtual visits, video visits, telephone visits. There's just so many ways that we can, assist our patients without physically seeing them in the office, which is a good thing in this day and age. And the other thing is, kind of doing some research on what type of resources will be available to you. So, they have certain support groups. I know like churches, they have support groups as well that are free. That isn't necessarily anything you have to go through insurance for. Things like that. Some people prefer kind of more one-on-one individual counseling with a therapist. That's reasonable as well. And again, a lot of these therapists are offering the virtual visits, which is more convenient for us at this time. The other thing, as I mentioned, is engaging in more social and physical activities. So of course you have to keep in mind social distancing now with COVID. And so, I think that slowly but surely we're opening up, lots of things, restaurants, movie theaters, etc. But everything is just being done kind of in phases, which is reasonable process. And so it's not that none of these things will be available to you, but, it's just it may not come as fast as one would like. But one thing that I would say is, you can go out for walks, right? And you can still keep your distance from people if you're outside. The sunshine will help you, the breeze, the weather, all those things are great. Going for like nature walks, exercising, again, increasing endorphins. So you can still do that, not just by yourself, but with other people, and still maintain your physical distance. So those are things that, you can definitely consider. As I mentioned before, reaching out, keeping in touch with family, friends, doing all those things. A good thing might be to consider even doing a journal. So writing down a journal, just kind of your thoughts, your feelings, you can always go back and kind of reference them and say, hey, I've noticed that after reading this, I'm very negative. Maybe I should do something about this. Or, just kind of tracking yourself and kind of having more introspection and being more in touch with your thoughts and your feelings. I think that's what the journaling, is about. It's very therapeutic and cathartic in a way. So that's good because it tracks your feelings, it'll track your progress, and then you can monitor that as well. And then, trying to re-engage in activities that you once, found like useful, joyful, things you like. If you're a person that, likes to watch, binge on movies and TV shows and things like that, and you stop doing that, you can do that. Again, it's also important to even take up new hobbies and new things. So this is also great to help, prevent like dementia and memory loss in general. And so, if you're a person who likes to do crossword puzzles or something like that, you can start doing that again too. But if you've never done painting or never were into reading, you only did crossword puzzles, and that may be something you want to try something new because that stimulates a different part of your brain. And if you like it, then that's great. So it's important to try to do things you normally like, but even try to take up new things, you might surprise yourself, right? And then of course, like I said, kind of trying to gain perspective into yourself and then, your current situation. So, that's really important to kind of check in with ourselves. I think that, prior to the COVID, I think a lot of us were so engaged in like externally, like what's happening out there in the world, how many, we're always constantly around people, we're always on some social media, we're, always interacting with so many people. And now with the COVID, a lot of that has been taken away. And so, part of the good thing about that is just the fact that you have more time to kind of have alone time, which I think is very healthy from a mental perspective, from a religious perspective, from a health perspective overall, is to really take time out, even if you are a busy person and there wasn't any corona and you spend, 12 hours a day talking to people and engaging, it's nice to have 30 minutes to yourself. If you're a person, for example, who likes to meditate, that's good. Or if you like to pray or just, just be quiet, sit outside in a patio, enjoy that sunset, have a, walk by yourself and doing all these things. That's healthy. This is all healthy for our being overall. And this is what I was kind of referring to before, as far as like, what's more important is going to be more effective is engaging, like doing interventions that are basically focused inward, inward versus like, okay, well, I think I'm going to fix my loneliness by just going out and hanging out with people and stuff. Like, yeah, obviously that will help, but it's that negative thought process, that negative thinking. It's those things that you have to focus inward that are actually the most important thing that are going to help. In addition to, like I said, enhancing social support and, improving your social skills. So this is why I say, I think it's important for people that are feeling this way to engage in some type of professional relationship with a therapist or, somebody or a psychiatrist or somebody who can kind of help. So, the difference is therapists and counselors and psychotherapists, they have PhDs, they're not medical doctors. They don't really prescribe you medications, which is fine. Not everyone needs to get on medications, but they're the ones that are more skilled and focused to do these kinds of things where they're helping you deal with coping mechanisms and things like that. And so that's really important. If you get to a point where you may think that you need medication, another thing is that I want people to understand there shouldn't be a stigma around that. Some people need to take medications for anxiety, for blood pressure, for depression, that's okay. And so I think a lot of people in general are just worried that if they get on a medication for depression or something like that, that they're going to be on it forever, and that's not necessarily the case. So for a lot of us, we have this kind of what we call reactive depression, or it's kind of like you're maybe depressed for only a short period of time in reaction to something, right? Somebody passed away, or, I went through a really hard time in my life, and it doesn't mean you have to be on medication forever. And so, usually what I do with my patients is if I have to put you on something for anxiety or depression, we'll do at least 6 months at a time and then kind of reassess, do you need to stay on this medication? Are we able to wean off of this? Have you been dealing with the coping mechanisms? Are you able to kind of, see the therapist and talk about these things? Do you feel like those things have been helpful? And then, every 6 to 12 months, we're kind of reassessing the need for this medication and trying to wean people off if they don't need it, because not everyone will. And so that's something to just also understand, that not everyone needs medication. not everyone needs it long term. And so that's something it's a constant, you know, kind of reassessment that we're trying to do with our patients. So that concludes kind of this portion of the PowerPoint presentation. And I just wanted to see if anybody had any questions, comments. Again, you know, even if you just want to share your experience, you know, these are things that we can all, you know, learn from, or have any questions, and I'm open to listen to those.
Thank you, Dr. Zagara.
You're welcome.
Go ahead and have questions. I don't see anybody that's typed questions into the chat feature or the Q&A feature. We can give it a couple minutes. And then
okay, that's fine. I don't know if you guys knew about this, but, and I don't know what the name of it is, but there was, I had a patient who told me that she found like a senior citizen service, and I guess their main focus was, you know, on psychological therapy. And I don't know what it was called. That wasn't the thing. I don't think she knew the name of it. So I don't know if you know of any resources like that that are not necessarily linked to insurance, because that would be good to kind of post on there so people can know that there's other options besides having to go to psychiatrists, you know?
of course, yeah. I don't know any off the top of my head, but I can look into it and send it to the attendees.
Yeah, that'd be great. I mean, there's so many resources out there that we don't know about for you know, mental health, for senior citizens, kind of in general. So that would be great. I kind of tried to look into it myself. I couldn't find it. So if you do, that'd be nice.
Okay, well, I don't see any other questions, but I want to thank everybody, and we appreciate you being here, Dr. Zagara, and thank you everyone for joining. We hope you'll be able to attend us for our next webinar, which will be in 2 weeks, on Tuesday, October 29th, with Sue Wilson. She's with 360 Elder Solutions, and she'll be presenting on creating connections while physically distancing at 1 p.m.
All right, sounds good. Thank you so much, Miss Landria. You have a good day. Bye, Jennifer.
Thank you, everyone.
Bye-bye.